So when I went back to Dr. Kulkarni, I only had some small symptoms to report. So I did that, and she said, "You probably misunderstood." And that was kind of overkill. But of course, she was answering because she already knew exactly everything which had occurred. And so then she comes up with a sham diagnosis to cover up for the few symptoms I had, and she said it was migraine headaches, and it was actually an off the books diagnosis. She never wrote it into the record. It's an off the records diagnosis. So she never wrote migraines into the records, and she never wrote with a migraine diagnosis, you need a long narrative from the patient saying, how bad it is and, how many times a week they get a migraine, so forth. She didn't do any of that. She just came up with a migraine diagnosis off the books. And then she started to prescribe medications. And one of the medications she prescribed was verapamil, which is a high blood pressure and heart drug. And because of my injuries which were there, I had heart failure. And I didn't even know that I had heart failure, but all the symptoms I had described was perfectly heart failure. And so what heart failure is your heart gets progressively worse, and you are suffering, and disability get progressively worse, and you die very soon. I mean, that's basically it. And then they started concealing this, and the same old thing with this as well. And then some bizarre things down the road. One time I called like at 10 o'clock in the morning to speak to Dr. Kulkarni in the office, and this is the time in which doctors are supposed to be treating patients. But instead, what the nurse said is she kind of spilled the beans innocently, and she said that Dr. Kulkarni is in a meeting with other doctors from the Innova practice and also other doctors from Innova, and that would have to be cardiologists who were secretly discussing my heart condition without even letting me know, right? They were not telling me I had a heart condition, but they were secretly discussing my heart condition. And then she also said there were other people that she did not know, and this would have to be the Innova executives and such. And some of them are even Fairfax County government officials who are on the Innova board. And then down the road, when I tried to get my records, they would not give me my records, and an employee told me I can come in and just pick it up. And when I went to pick it up, the employees were actually about to give it to me, and I guess they saw some notes saying to contact higher-ups. The higher-ups were not even at the office. And then like half an hour later, a high-level Innova official shows up with 3 police officers, Fairfax County police officers, and they all go into the back room. Now, if I was doing something wrong, then the cops should have come right up to me, but obviously I wasn't doing anything wrong, and they went to the back, and then they came back 10 minutes later, and when I asked the Innova official why the police were called, she said, "Oh no, it has nothing to do with you, it has to do with something in the back." And really all that, and then I found out what went on in the back, because what they did for 10 minutes in the back is they were selecting what records to release, and then since they hadn't released the full records, they were putting whiteout on the page numbers, and none of the office workers helped them, and these people could not figure out that, and what they did is they had actual lumpy whiteout on the page numbers, and they could not figure out that all they had to do is run it through the copier and you have a nice clean copy. So obviously it's not done by the office workers, and the office workers did not even help them, because they could have shown them how to do it, but obviously they knew it was something illegal and they didn't do it. So, but not only was it illegal to delete the medical records, but what they were to tamper with the medical records, but what they were actually deleting is the page numbers they left out is the page numbers that show that an MRI test was ordered. So what they're actually trying to say is that the MRI test was never ordered. So since all the crimes occurred at the MRI test, they're literally trying to say those crimes could not have occurred because there was no MRI test. And that's actually what they were trying to say. And that's what they do, and that's why they use the whiteout. And so and the only people who were in the back doing this, and as the person already said, the police were there for something in the back. And so what it means is these people are accessories after the fact to those crimes, and those are all felonies. Anyway, and then so down the road, Dr. Cochran would interfere, or he would conspire with some of my physicians in Maryland, so as to conceal facts and to hide the truth. And then, because of my health condition, but I did have some success getting, even though Dr. Cochran had conspired with these doctors in Maryland, I had some success in getting them to do the right thing, and I was getting a lot of information, including the information that the arteries in my left arm, from my hands all the way through my chest, are completely messed up, and at the same time the right arm, there's no problem, and that never happens. And it's the only way it could have happened is exactly what they're accused of doing, which is shooting water up through the artery and trying to get the blood flushed out of the brain. And so anyway, but then because of all the medical, so even though I was having success with my doctors, even though they were at first concealing, because I was more sick and I could not work, so still I could still afford to pay for my doctors. But the way with the rules which came with Obamacare is that I was forced. Actually, the Maryland government, they actually wrote a letter saying that they enrolled me into Medicaid, and Medicaid is the government medical assistance program, right? So even without my doing so, they enrolled me. And even if I hadn't, the way it works is, if you are eligible for Medicaid, you are not allowed to buy private insurance. I did try to buy private insurance, and they told me since I'm eligible for Medicaid, they could not sell it to me. And also, when you go to doctors, they will not see Medicaid patients because it's unlawful for them to take payment from Medicaid patients. So in any way, so I have to end up on Medicaid. But it's not just like an insurance thing. It's actually more like a nanny system. So they have a contractor, and this contractor happens to be the one owned by another health system, which is MedStar, and this contractor is called MedStar Family Choice. So I really don't have any choice in any of this matter. And MedStar Family Choice, actually their job, they are not like an insurer. Their job itself is to give me health care, and if they choose to, they can select what physician and when and how and so forth. So it's really, and even the contractor, MedStar Family Choice, they're required to have medical malpractice insurance because it's considered that they themselves are giving the health care. So, but anyway, the doctors that they assigned for me, these were the worst, the lowest. And as soon as they just saw me, and within seconds they figured out that they can make a lot of money from Innova and the others who harmed me. And they immediately went and conspired with these people, and they started putting all kinds of things in my records to help Innova's case. So since Dr. Kulkarni had not, and the thing is, I never even told them about Innova. I only told them about the MRI facility, and it looks like they all contacted and they went ahead and made their deals. And so really what you hear. And so what they did is they put all false information in my records, and they never gave me medical care. Obviously, how can you give medical care? Because the basics of medical care is to write a full history about the patient's medical history. So if you don't write the medical history, how are you going to treat the condition? I mean, you have to say where the condition came from and what the condition is. I mean, you have to identify the condition before you can treat it. So, I've been on this thing since May of 2014, and it's really nearly 2 years, and they haven't given me any care. It's just zero medical care. And at the same time, I have gone through, I have spent the equivalent of like hundreds of visits with them. So really, they just have to give me like 3 visits worth of stuff, but I have spent the equivalent of hundreds of visits with them. So they are spending all this government money now to evade all this, because not only did they conspire, their doctors conspire with these people who committed the crimes to hide the medical facts, and so that's the side effect of hiding the medical facts, is I don't get medical care. So they never gave me any medical care, and they break every single rule that the government puts for them, in how they're supposed to take care of the patients. And then when I complained up the chain to that MedStar contractor, it actually became even worse, because that person immediately started to cover for her doctors. Right. And so by covering for the doctors, and you can hear all these tapes. These are the tapes coming at the very end, which shows the full conversations I had with these people. So I'm dealing with the state's Medicaid contractor, which is MedStar Family Choice, and that contractor is owned by MedStar. And so that contractor is just not giving me service, and you can hear the phone call. It sounds just like when in the old days, when there is like on the basis of race, there is like a employment or housing discrimination. There's just a set of excuse after excuse after excuse, and so the people are very polite, and they sit with these people and they talk for a long time, but at the end of the day, there's still no job and there's no apartment. So this contract, and then because this contractor is actually supposed to be managed by the state of Maryland, but it so happens, since MedStar is this giant company that owns his contractors, the state of Maryland does the bidding of this giant contractor. And at one time when I was really sick, I called the doctor to make an appointment. They knew I was sick, and they literally tried to kill me, which is basically when I called the doctor and I made the appointment, they called the state. This contractor, this MedStar contractor, they contacted the Maryland, the state that maintains the Medicaid rolls, and somebody actually went into the system and knocked me out of the Medicaid rolls, and I could not get reinstated for so many more days. And so now when I complained to the state, I've been writing letters to the state. The state hasn't even sent one reply back. So they've got the whole system gamed. They've got, even the agencies I'm supposed to complain to, I'm just writing very nice, polite letters showing all the facts and the evidence, and they just intentionally keep quiet. So that's very easy. They sit in their office like in Baltimore somewhere, and someone is writing a complaint to them, and they just conveniently ignore the whole thing. So that's the way it's been working. So really, and so it goes to the point, you don't want to go through what I went through in this state and this region. So you're better off just go somewhere else for your medical care, so you don't have to deal with this nonsense.